Good afternoon, and thank you everyone for tuning in today, and I hope you continue to follow public health recommendations over this past weekend. I'd like to remind everyone that this Thursday, October the 29th, is our COVID-19 Town Hall. Tune in at 7 p.m. and join myself, Dr. Richardson, and Paul Johnson as we take your community questions. As well, we will have two special guests joining us this Thursday. Alex Johnson, the Hamilton Wentworth District School Board Chair of the Hamilton District School Board, and Patrick Daly of the Hamilton Wentworth Catholic District School Board, Chair of the board as well. They will be joining us to answer any questions you have around their issues and the work that they've been doing to keep our students and teachers and participants safe. And again, thank you Cable 14 and CHML for carrying these events. They're very important to help us get this message out. We thank you for your contributions. And you know, Halloween's coming up this Saturday, and I want to again reinforce that our local guidelines for safely celebrating can be found on our website, hamilton.ca/coronavirus/celebrations during COVID-19. Public Health has listed the recommendations for both handing out Halloween treats as well as trick-or-treaters. So for those wishing to stay home and celebrate, there are many fun and safe ideas for celebrating Halloween at home. So please avoid those house parties, those large gatherings this Saturday with others who do not live in your household. Private gatherings have limits of 10 people indoors or 25 outdoors and still require social distancing when you do that. So minimizing your social contacts as much as possible is extremely helpful at this point. So do your part. Many people have shared their COVID fatigue. I understand that. I think we're all suffering from that a little bit. But, you know, I remind you that that virus is still out there. As someone said, we may be wanting to forget about the virus, but it's not forgetting about us. And so we need to remain vigilant, and our efforts to contain the spread of the virus is still very much important. And if we don't, we will be headed into another lockdown, which would be catastrophic for our economy and for our healthcare system. So let's do our best to avoid that. And then again, during this difficult time, it is important that we recognize and take care of our mental health. Continue to connect with friends and family virtually as much as possible. And if possible, get outside for some exercise. And if you're struggling or someone who is struggling, you can call COAST 24/7, day or night at 905-972-8338, or the Kids Help phone line at 1-800-668-6868. They are available anytime, day or night, to assist with those that are having mental health issues or just want to talk to someone, and they can help you through or get you to appropriate treatment. On the Kids Help phone line, you can also text at 686868. We will get through this together. We continue to do the good work. The majority of our citizens are doing the right thing, and I see that in the broader community, and we thank you for those efforts. Very important. We need to continue to look out for our friends, our family, our neighbors, protect one another, keep those masks on as much as humanly possible, and we'll continue to do well as we have in you know the whole time through COVID. We've done pretty well as a community, and we want that to continue. I want to pass it over to Paul Johnson, our Director of Operations at our EOC Operations Emergency Center. Paul Johnson.
Thanks very much, Mr. Mayor, and just want to say that as always, our Emergency Operations Center is maintaining close contact with Dr. Richardson and her team, understanding what's happening in our community. And we are in a fairly stable pattern right now in terms of no new closures to announce. We continue to do our reopening as we've announced over the past number of weeks. I do want to say thanks to our public works staff who have been working diligently to have a very scaled back and different looking mum show go forward this year. And I know that lots of people were disappointed. Things were all booked up and that we're trying to get people through, but it has to be done safely. We could not have this event be a problem. And so congratulations to those who have allowed that to occur. I also want to go back to last week and say a word of thanks to a group that I forgot to discuss last week, and that is our early childhood educators. Last Thursday, I believe, the 22nd was our Early Childhood Educator Appreciation Day. And I have to say that through the crisis and through our pandemic, our childcare community, and in particular those who are in our childcare centers each and every day. Those registered early childhood educators have just done an amazing job. In the height of the pandemic, they were helping us to deliver childcare and to first responders and to other essential workers. And then as we began to open our childcare centers, they have been doing a fantastic job of keeping families informed, following the guidance and the rules, as well as continuing to do what's really important, and that is ensure our children in Hamilton have the very best early child development opportunities. And so in a belated fashion, I want to thank those that work at the City of Hamilton and deliver services at our Red Hill Child and Family Center, but also to all of our early childhood educators across the community who do such a great job. And I apologize for missing that last week. Not COVID related, but I do want to talk a little bit about the situation that unfolded at the Emerald Residential Care Facility on Friday, and just to provide a bit of an update. So again, this situation evolved, and the actions that we took on Friday to fully decant the home, remove people from the home on Friday, was not a result of COVID-19. In fact, many individuals in the home during the week had been tested, and all those tests came back negative. So this was not about COVID-19 in the home. It was, however, about a number of other troubling things that caused us to believe that it was in the best interest of those living there to be moved out. I've been asked regularly, so how did it go on Friday? How did the operation, the carrying out of that operation go? And it's really two sides. I'm very thankful and very happy that from our city staff perspective and our community partners, things went really smoothly. We had good plans in place. We had the things we needed to ensure that we could carry through what we were trying to accomplish. All of those things were in place, and so I want to thank those folks. But I also recognize that for the residents of that home, this was a very anxious time. There were all sorts of emotions because there was no notice provided about this. It was something that needed to happen very quickly. In terms of the status of the residents, all remain temporarily housed who accepted support on those evenings. Some chose to make their own accommodations, which is their right, and do believe at least one went with a family member. But for those who accepted the support from the city and our partners, they remain temporarily housed, as you can imagine, over the weekend. Pretty hard to find permanent accommodations on that short a notice. We've started that in earnest today. All were assessed and provided temporary housing in a form that best met their needs. A big question, of course, is always why. The why of this was a combination of factors. The property issues that went on at this home were significant across fire, across our property standards from a bylaw perspective. Some of the pieces that residential care facilities must adhere to under the schedule of activities for an RCF were not being followed. And there were also some public health concerns, both in the operation of the center, but also the infection prevention and control. And in the midst of this pandemic, we were very concerned that if COVID was to enter the home, that it would again have a pretty significant chance of spreading. So there were multiple issues, but there were also staffing issues. There were security issues, and there was an overall sense of worry about care. And so with all of those things combined, and recognizing that we did not feel that staffing was going to be secured throughout the weekend, the difficult decision was made at the request of the receiver, who is handling the receivership of this home, for the city and its partners to step in and decant the home. The timing of it, I've also been asked about. Why did it have to happen on a Friday afternoon? I think I've shared a little bit of that. We weren't convinced we could get through the weekend and have staffing 24/7 there. So that was the big reason that we decided to move with some speed. We are concerned about some of the security and living conditions in the building as well. And some have said, was this always the plan and you just didn't share it with the residents? That is absolutely false. In fact, I went to bed on Thursday evening with a plan in place. We felt for an operator to step in, but even overnight on Thursday and into Friday, the situation continued to deteriorate, and we were unable to find someone to step in and stabilize the operations of the home with the home still operating. And so we took the decisions we did after we received that request from the receiver midway through the afternoon on Friday. So the timing was not the way we would normally like to do it. We would have liked to obviously have provided some better notice and some to the residents who were there, but it is what it is, and we had to take that action. The city, obviously paid for by the receiver, but the city did arrange for 24/7 security to be on site. Anyone arriving, both residents who weren't in the home at the time we took this action, or family members or caregivers or anyone in the community who was arriving at the home, was directed by our security to the right place to get information. So there is that there. The other piece was that there were a number of broken windows. We did not want people getting back into the building, both those who might have resided there or others in the community. And so the security will be in place until all of those windows are secured and boarded up. And the locks were also changed on Friday evening, so there is no access available into the building except by those who are now in control of that building. So the next steps obviously are, most importantly, working with people one-on-one to understand where best, from a permanent placement solution, a permanent housing solution, what works best. That will take a number of days. It's not our intent for people to stay in temporary and emergency shelter type environments, but for now, people are safe, medications are being provided, health supports are there when necessary, social supports are there. We will take care of people gathering their belongings and everything else that they need to do to be successful in moving on. A very unfortunate situation, but wanted to take this opportunity to provide a bit of an update on Emerald Lodge. With that, I'll turn things over to Dr. Richardson.
Thanks very much, Paul. And indeed, a difficult situation on Friday, and you know, very important decisions that needed to be made to make sure that people were safe and we could move forward from there. So I'm just going to give you the stats from today and then go over a few things. It also seems to be a bit of a thank you Monday, so that's kind of interesting too. But it's we're at 1,698 cases in total today, 37 new from yesterday, and of those, 87% are resolved, making it about 162 active cases right now. There have been 48 deaths to date, and the newest being, the last death being a gentleman who passed away in his late 70s in hospital back on October 20th. We're currently reporting a total of 10 outbreaks on our website, with no new outbreaks added as of today, although some do remain under active investigation. And of course, you can find lots more details about those and all our local COVID-19 activity on our website. I do just want to say we are having an average now of about 20 new cases per day, which is a stabilized number from where we've been last week. And so that's why I'm saying this is a thank you Monday to all of our community for all the efforts and the sacrifices that people have been making. We have been seeing tremendous compliance with mask wearing out in the community, as well as a decrease in large gatherings being reported, and that's very important. And despite the fact that we do continue to have the rise in daily numbers, we are seeing a steadying of that average number of cases per day, maintaining it around the 20 per day mark after a steady rise in September and going above that number. It's important to be mindful, though, that despite the fact that the numbers have steadied, we are at any time susceptible to an increasing number of daily cases. And we understand absolutely that it's very difficult to change our habits. In fact, Paul and I were talking one day a couple of weeks ago about how we could just easily slip back into habits that that we used to do pre-COVID-19, and they're just still there in our memories, our routines. And so it's, you know, we know just how difficult it is to change that. We've been asking everyone to change not only how they go about their daily lives, how they get their groceries, you know, what they're doing with their kids getting ready for school, but also what we do for all our celebrations and our gatherings. But the changes that you're making, that everybody is making, is helping Hamilton to keep our restrictions down, helping us to keep business open, and helping to keep our community as safe as possible while we get through these challenging times together. The mayor talked just a minute ago about Halloween, and I know everybody is talking about that. That's a big subject as we head into Halloween weekend, and we can keep our little ones in the community safe. But it's really important in terms of the adults, and I'm speaking right now to the adults, both the young and the old, and we are still seeing the majority of our cases appearing in those 20 to 29 and even up to 59 years old. So with Halloween coming up this weekend here in Hamilton, as it is all around us, I'd like to remind everyone that gathering with those people outside of your household is not recommended. So, you know, Halloween parties that aren't online, that aren't virtual, are definitely a no-go and are not advisable. And we want to continue to keep those daily averages steady, or if possible, even better, declining. So we want to keep up those good habits that people have been doing, find alternate ways to celebrate Halloween that doesn't involve parties and gatherings. the changes that we make now are going to dictate what happens in our community as far as restrictions go in the future. It's going to dictate what happens from a case count, and that, of course, is what leads to a decision around more restrictions or not. So it's really important too that if you aren't feeling well in any way, to stay home, even if it's just a few symptoms that you think are very mild in nature. It's important that you isolate and get tested if those symptoms are consistent with COVID-19. Remembering that for any infectious disease, those things that start with the sniffles and the runny nose and the sore throat, or even the tummy troubles, are things that we should be staying home with. And so particularly right now during COVID-19, it's essential that we stay home. And if we think it's consistent, we go through those assessment tools online, then do go and get tested. We do continue to see an increase in people who are going about their daily lives with symptoms, or while they're waiting for the test results to get back. So it's really important that that's a time to isolate, even from people within your home, up until you get that test result. And even if it turns out not to be COVID-19, you should really stay home until your symptoms have resolved for 24 hours. So that's it from me, Mr. Mayor. Back to you.
Thank you very much, Doctor. Appreciate the update. Paul Johnson, appreciate it as well. Let me just get rid of this here. There we go. So we, traditionally thank our essential frontline workers. Let me just single out the folks that are in food production. I've heard from many that they've had to change their entire process and physically separate and essentially redo how they produce foods in our community that we still take on the shelves and bring home with us. And there are many in our community that are in the food production and essential production lines. And we want to thank them for their effort to readjust their production to keep us all in the foods that we need and in the essential products that we need. And at the same time, having changed all of their processes to accommodate all of that. So well done. Thank you for that. And certainly it's going to serve us well into the future in terms of the processes that you're putting into place to keep your employees safe. These frontline workers are obviously counting on us to also do our part, us being our collective community. And so keep staying the course, follow those mask guidelines, the social distancing guidelines, sanitizing, spaces and hands as much as you can. All of that is going to matter as we continue to work our way into some sort of an equilibrium as long as this virus exists in our community. So thank you for all that work. And I'm going to turn it now over to Jasmine to field some media questions. Jasmine?
Great, thank you, Mr. Mayor. We have 4 media on the line today, so we'll start with 1 question and 1 follow-up for each of you. We'll start with Bobby from CBC Hamilton. So Bobby, you can go ahead.
Thank you. And before I ask my questions, does someone mind looking at the YouTube link to make sure that it's working? Because I'm not sure it's made public yet.
Thanks, Bobby. We are working on that in the background.
Awesome. Okay. I guess my questions are for Paul. Hi, how you doing? I hope you're doing well. My first question is, what did the assessments of residents at Emerald Lodge show? And where are they going to stay permanently?
So obviously, I'm not going to share details of each individual there. I can say that there are a wide variety of residents at this facility. Some who were in their senior years and are going to need some more senior level care, but there are also some young adults in this facility as well. So it really did cover the spectrum, women and men, both at this facility also. Permanently going forward, there's a number of things in play. For some, other residential care facilities in the city could be an option. We do have some locations, and so those will be things that we can explore. We're also working with other housing providers and other community organizations to see whether there are supported housing environments that would work a little bit better. And then I know our health folks will continue to assess certain individuals who may have been more in line for a retirement home or a long-term care placement as well, and see about that. So the short answer is it could be across a number of areas based on the assessments that will occur. But because the makeup of the people who live there was sort of all demographics and all ages, it'll be a combination platter of a number of places within the community.
Thank you very much. And my second question is for Dr. Richardson. I noticed that today according to our website here, there are 37 new cases, I guess, from yesterday's posting. And I just wonder, is it too early to determine whether like an uptake in cases might be related to Thanksgiving weekend celebrations?
There we go, Bobby. Thanks very much, Bobby. In terms of Thanksgiving, we tend to see increases a couple of weeks out. So we're a couple of weeks out now from Thanksgiving. So I'd say over the last several days, we would have been seeing that increase. And in fact, what we've seen is actually a bit more of a steadying this last little while. So it may have been that uptick earlier, now that testing is really quite easy to get into and the turnarounds are quick. It might have been that some of that uptick was related to Thanksgiving. But we've now had a steadying, which is really good news. I would say we do continue to see that socializing really as being part of the challenge, and that's why it's really important that people continue to, stick to just the people in their households and not be out socializing.
Thank you very much.
Next question will be to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks for taking my question. My questions are for Mayor Eisenberger today. Halton politicians, including mayors in Halton, appear to have significantly influenced the province's decision regarding not imposing further restrictions in that region. So I'm looking to find out, what messages you are giving the province when it comes to what you'd like to see for Hamilton.
Well, thanks, Joanna. I appreciate that. And I have shared some concern around the second guessing of public health recommendations that some are making in Ontario, and Halton included. And what the Premier indicates that wasn't an influence. I did watch his briefing at 1 o'clock, and he's indicated that didn't influence their decision, but they were certainly free to express their opinion, and he encouraged them to do so. So I expressed, that they have their right to express their opinion on this. But if our opinion has been, and certainly I share this, that we're to be guided by public health and public health recommendations. To be second guessing that, I think, is a bit worrisome, because it diminishes the trust in the work that our public health agencies and medical officers of health, both provincially and federally and locally, are making in terms of recommendations that we need to employ to keep the community safe. And so I worry about that. I think I'm not about to second guess our public health experts, and you know what, we can all, I worry about whether or not restaurants should be open or not open, or but it really needs to be driven by data, and so far we haven't demanded to see evidence on an ongoing basis. We have just put faith and trust in our public health officials that they're working from data and working from evidence and making recommendations that are going to keep us safe. So I'm going to stay in that space, and others might act differently, but certainly that's my view on the issue, and I'm going to keep supporting our public health officials and their recommendations.
That same letter from the politicians in Halton, it called on the province to be more transparent about how these decisions are being made, what metrics it's using, how it's going about making those decisions when it comes to what restrictions go to what regions. Do you join them in that call, or what are your thoughts on that?
Again, it's kind of a second guessing of the data that's being utilized, and if they want to see the data, I suppose that's possible. But we have to have some faith and trust in our public health recommendations. So I'm of the belief that congregate settings are particularly problematic, and we cannot necessarily separate them out in individual cases. And I think the reaction that the public health officials from the province took relative to the case spikes that we've seen in Toronto, York, and Ottawa, were based on the increasing numbers and worries about that kind of community spread that would spread into a whole range of other places. So I worry about second guessing of this information. We have to have faith and trust in our public health officials. We have to have faith and trust that they're using data that is current and up to date, and that they're making decisions not based on politics, but based on public safety and ensuring that we minimize the spread of virus in our community. And I think that's the right space to be in. And I certainly mentioned that at our Greater Toronto, Hamilton, and area mayors briefing that we had this afternoon, and I'll continue to speak out about that into the future.
Thank you, Mr. Mayor. Next question will be to Katrina Clark from the Hamilton Spectator. Katrina, you can go ahead.
Thanks very much. My question's for Dr. Richardson. So Public Health has said that they're not releasing any more information about the Hamilton Basketball Club outbreak and not naming the club for privacy reasons. So I'm wondering what these privacy reasons are and how this is any different from, say, a church or a spin studio or a hospice where settings would be named.
Sure, absolutely, Katrina. And this is really important for us as we go about our business. And just as the mayor has been talking about maintaining the trust and confidence of our community is so important to us when we're doing our work, but so too is the trust and confidence of everybody in the community that we will also keep their privacy when they're sharing with us the very important health information that is essential for us to do our investigations, to understand, where people have been, what they've been doing, how sick they are. And so we need to balance those two things as we go through all of these investigations and as we report them back to the community. So here in Hamilton, we've been quite forthcoming when it comes to information about outbreaks in workplaces. I've all started out that way when it came to long-term care homes, retirement homes, and those sorts of settings. And we've also been that way when it comes to workplaces and all of the outbreaks that we've had here in Hamilton. But we balance again that giving enough information for the public so they can understand what is happening and really be able to understand what measures they need to take related to this pandemic, but also balancing the privacy needs. So that's what's happened in this case, is that we're looking at what degree of information we can release that won't result in individuals being identifiable and that sort of thing. And that's why we've chosen to give all the information we possibly can without adversely affecting anybody who's involved.
Okay, thanks. My second question, Dr. Yaffe was mentioning in the presser earlier this afternoon that the SpinCo patient 0 is linked to a bar in Toronto. They had attended a bar. There was not an outbreak at the bar, but she was just saying that. I'm wondering if Public Health is aware of this and if there's any more information, like any updates you can share about SpinCo today.
Yeah, there's really no updates about SpinCo. That outbreak is one that we've, followed along and shared a lot of information about. And when it comes to specific cases, we don't give out further information than we've done along the way and with this one.
Great, thanks, Dr. Richardson. Next question will be to Don Mitchell from CHML. So Don, you can go ahead.
Okay, I think it's a question for Dr. Richardson, but it might be Paul Johnson as well. So I'm going to circle back to the basketball thing, and I get there's privacy involved and you don't want to tell certain details about it. Can you give me like the nature of it though? Was it a private setting? Were they out on a basketball court outside? How many people involved? That sort of thing. Can we give some detail on that?
So really, when it comes to this particular one, we've got up on the website a fair amount of detail. We're sharing with you that it is a community recreational group. It is a basketball team. They are Hamilton based. We've given you the timing for the outbreak, but that's as much information as we're able to share in relation to this one.
Okay. The only other question I had too involved St. Joseph's Villa. So they declared an outbreak, I think it was last Tuesday, and it was over in 2 days, and it involved an outbreak with a staff member who was not a frontline worker. Can you elaborate a bit on that and how that ended so quickly?
Oh, so what happens sometimes with outbreaks is that, it takes some time sometimes for the individual to, realize that the symptoms they're experiencing aren't their usual seasonal allergies, or they're, not something else, and to recognize that they do fit the criteria to get tested. And, it may take a day or two to get the testing done, a day or two for the test results to get back, and then for us to look into them. And so you can lead to several days evolving before that information is there. And with the fact that for long-term care facilities, it takes just one case to declare an outbreak, we can end up declaring an outbreak well into if the person's symptoms started early, we can end up declaring an outbreak well into that individual's course. And then once they've passed through their course, then we can declare it over if there've been no other cases. So that's what happened in that case.
Thank you.
Thanks, Dr. Richardson. We have a bit more time, so we'll run through one more time. If each of you'd like to ask one more question, we'll go back to start with Bobby from CBC Hamilton. Bobby, did you have another question you'd like to ask today?
Others can ask before I ask mine. Thanks.
Okay, we'll go to Joanna next then. Joanna?
Sorry, I wasn't prepared for that. Thanks so much for the extra question. Dr. Richardson, can you sort of give us the update this week on where you think we stand when it comes to the possibility of Hamilton having further restrictions? As you know, when you look, everyone's talking about Halton, but we actually have higher numbers today than Halton does. So can you talk a bit about what our chances are?
Sure, absolutely. You know, this is one of the reasons why we've been so concerned when we saw our numbers going up over the last 10 days and becoming concerned that, you know, we would have an ever increasing rise in cases, and that would put us in a position where really we needed to take more steps in order to control the spread of the disease. Now, nicely for us, the last few days, it's been leveling off. We've actually come down from the average number of cases per day, which is good news, but we're just holding our own. We need to continue to see that stay level, or better yet, as I said earlier, bring those numbers down even further. So it's been great. You know, by far the majority of people are following guidance and doing the things that need to be done. And we just need to keep keeping that up, especially as we go through Halloween weekend.
Thanks, Dr. Richardson. We'll go back to Katrina. Katrina, if you'd like to ask another question today.
I don't have another question. Thanks, though.
Okay, thanks. I'll check with you, Dawn. Okay, maybe not Dawn. I'll go back to you, Bobby, then, if you'd like to ask another question.
Yeah, I don't think I have any other questions. Thanks, though.
Okay, then, Mr. Mayor, we'll pass things back to you for some closing remarks then.
Well, I have a question. So, Doctor, you know, the rules around long-term care facilities and visitation, I think things have tightened up a little bit. It'd be maybe worth reminding folks how we're, you know, adding some added level of protection for long-term care facilities.
Yeah, thanks again, Mr. Mayor, for asking about that. It's so important, you know, as we're going through COVID-19, we're most concerned about protecting those who are most vulnerable, of course, and those in long-term care particularly fit that category, as well as those that are in retirement homes. So the end of the week before last, we did reach out and ask long-term care homes to be very diligently following Directive 3, which is the directive under which they operate during COVID-19, and to be making sure that they're limiting visitation to just those that are most essential, as well as limiting visits out for residents. And of course, we fully appreciate that, you know, these are difficult times and difficult things that we're asking people to do that are, you know, everybody's quality of life is very much important. But when we're seeing those higher numbers in terms of cases and, you know, really wanting to protect people who are living in the home. So both for the staff who are coming in, who are very diligently wearing their PPE, they're doing screening every day, but the visitors as well, then to restrict those to just the essential visitors and to limit those visits out while we're at this higher rate is really important.
Great, thank you. I have no further questions. So let me thank Bill Custers and the entire team at Cable 14 and Clear Cable for helping us ensure that these availabilities run smoothly. And of course, to all of our public health workers that are working, you know, day and night to try and keep our community safe and contact trace and doing all that important work, testing and otherwise, to ensure that we do the best job possible. And we ask you out in the community to keep your distance from people you don't live with. If you're sick, stay home. Wear a mask indoors or when maintaining physical distancing isn't possible, as much as possible, and keep washing your hands and sterilizer or the touch spaces that you have in your home and in other places that you come in contact with. It's very important. And, you know, a reminder again that our next briefing will be coming Monday, November the 2nd. And again, a town hall this coming Thursday, 7 p.m. with the three hosts that are here today, as well as with the Alex Johnson, the chair of the Hamilton School Board, Public School Board, and the chair of the Catholic School Board, Patrick Daly, will be joining us as well. We'll see you then with any questions you might have then. But in the meantime, stay safe, keep your friends and family well, and we'll talk to you soon.